And when you get to G, there's two words. And I need to just encourage you, you're going to hear these words, and you just need to believe that what they're saying is what they're doing. Now, when you get to these words in rehab next semester with Ms. Hobday, she's going to be using these words in the NDT technique. When you get there, you do whatever you want to with these words, because they're going to have kind of a different contextual meaning. But for right now, let's just think about this. If I said I want to facilitate a movement, what am I telling you that I'm going to do? Yes, that's a wonderful example. I'm going to help them. I'm going to facilitate it, right? If you want to make a good income, I want to facilitate your efforts by giving you an education. But then there's the diametrically different position of inhibit. And inhibit means I'm going to resist. All right? So we always start by facilitating a movement. So we take that person in from D1, they're extended, they're internally rotated, they're pronated, they're ulnar deviated, and then I'm facilitating that movement. Okay? So we start by facilitating a movement. But then comes a time where they know how to make the movement. They're getting pretty good at it passively. They have full range of motion. So mobility check. Now let's stabilize. And we do that by integrating the three types of muscle contraction. This is our inhibition. We're going to inhibit. The question is, what's appropriate? Let me give you an example. Well, Dakari, I hope your day is going well. What I want you to do is we're going to move through this position right here, and I'm just going to resist certain points. Okay, so you know your movement here for me, and when I resist you, you're not going to be able to move because you're weak. Okay, so go ahead and take that movement on up for me. Here's isometric. Relax now. Okay, can you go ahead and continue that movement? Here's isometric. Relax for me. Can you go ahead and continue that movement? Here's isometric. What did we call this earlier? We called it multiple angle isometrics. Then we facilitate the movement. Let's inhibit the movement again using concentric focus. You're going to take yourself through right here. Okay? And back to here. You're going to here. You're right here. Go ahead and go. Notice my manual contacts. Where are they at? Distal humerus, distal ulna. Okay? Relax. Let's do another one. Come on up for me. I'm inhibiting. I'm inhibiting using a concentric contraction. Right? Relax. Again. And what am I doing? Focusing in concentric contraction, D1 flexion. Ready for the next one? Now, okay, you got that movement, right? Okay, go ahead and push now against it. Same thing. Concentric contraction, D1 extension. And I'm just keeping my hands in such a point with my lumbrical grip that I'm able to resist, I'm able to inhibit that movement. I did isometrics, now I'm bringing in concentrics. Okay? Go ahead and come back. Now listen, you're dealing with a bunch of strong people in this room. You bring in that first disease patient, and you're going to feel it. You're going to say, oh wow, they're weak. This is easy. Go ahead. thumbs. I'm giving him contact points. I'm guiding. Relax. Again. Last time. Very good. Relax. Now, I'm facilitating. Facilitating. Okay. Now, I want you just to resist me, but let me win. Good. Now resist me, but let me win. And I'm guiding through with an eccentric focus. Resist me, but let me win. Wow, there's something popping in there. Okay? That was what? Eccentric D1 flexion. Here's eccentric D1 extension. You ready? Resist me, but let me win. Come back to the starting point. Resist me, but let me win. Starting point. Resist me, but let me win. See it? Now, what can you do with all that? You can do a lot with that. But it takes practice. And what you're going to see is some seasoned veteran PT like Bill roll in the door. He's got a baseball player who's rolling it, moderate protective phase, kind of creeping into that minimum protective phase. And he's like, all right, this is the motion we're going to be doing today. All right, so here's what I want you to do. I want you to resist me. Now go. Resist me. Resist me. You're not resisting anything. I'm still just beating you up like crazy. Are you ever going to resist this? Right? Rotation first. And now you're like, my sensory input's going through the roof right now. And my heart rate's jagged. Whew, you're a strong guy. Okay, so my battery's running low. So what are you going to do with that? You're going to upgrade your strategies. Constantly looking at what else can I do? That is the pattern. Now let's talk some techniques. And these are a little easier to swallow. These are just what a person named Kabat, Cross, and Vaughn came together and said, we're naming these techniques. You already know holds relax. You already know agonist contract. Heck, you even know contract relax. The next one is rhythmic initiation. It's simple. You already know it too. Rhythmic initiation is simply passive range of motion. It's simply passive range of motion. It's when people have deficits, though, in initiation, coordination, and relaxation, and you progress it. All you do is you get them started passively, and then the technique is simply this. I'm gonna use D1, D2. You could use flexion and extension. Just in the sagittal plane. Okay? I'm gonna use D1, D2 so you can continue to see it. You can use whatever. Rhythmic initiation is simply saying, show them what to do passively, and then active assist, go ahead and you perform it, and I'm just coming in and I'm helping. Okay? And then we move to resistance. Concentric or isometric. Stop right there. Resist me, hold me. Right? Same scenario goes up. Isometric, eccentric, concentric, whatever you want to use. But that's what rhythmic initiation is. Another technique is rhythmic rotation. Now, initiation, that means you're initiating the movement. You start with passive, move with active, assist, and then you resist it. So you're facilitating, you're helping a little less, and then you're inhibiting. Rhythmic rotation is basically the same thing, only you're using rotation. So what plane does that happen in? It happens in the transverse plane. One of the very simplest techniques, and I bet you all know this one, it's called a lower trunk rotation. But if PNF is concerned, they went in and they gave it a proprietary name of rhythmic rotation. Here it is. And it's passive. Lumbar rotation. Do you remember doing this just a few weeks ago? Okay, and then it just says, okay, now you do it. Good, and I'm just helping. Where am I going to have to help at? Probably the concentric phase. This guy's not weak, so I don't have to help anywhere. And then I'm going to resist it. Okay? That's all that step takes. Then we advance just a little bit more. And now what you're noticing here is progression, right? We're doing a little bit more than what they were used to. Progression. We're looking at alternating isometrics. Now when you see alternating isometrics and rhythmic stabilization, you're going to think, what the heck is the difference, Kendall? Your TheraX textbook does a better job of differentiating these than your neuro book. But let's just kind of look at them. Alternating isometrics. I'm going to stand over here. You're going to have to use like complete transparency through this body so you can see it. I have a bicep right here in my hand. Rather large one, actually. What is the antagonist to that bicep? All right, so we covered that this morning, right? Here's alternating isometrics. I'm typically using a single plane. It's a very slow procedure. Resist me, hold me right there. I am doing elbow flexion, true? Everybody see it? We're closer to 10 seconds on this one so everybody can see it. And then I say relax. Remember with isometrics, like we learned last week, you didn't hear this, you didn't hear this. We want to graduate in and out, right? And then I'm going to go to the antagonist and I'm going to say resist me. That's all alternating isometrics are. What's the difference between an alternating isometric and a multi-angle isometric? Resist me right there. Multi-angles focus in on one agonist. That's it. Alternating, you're alternating between the agonist and the antagonist. Now you see that's not very difficult, is it?
What's a multi-angle?
The multi-angle is, I start them at around 0 to 5 degrees. Resist me there. 5, 4, 3, 2, 1, relax. Graduate out. Move them up.
Yeah.
Now, I'm going to take just a minute and pause for a second. And I want you to reflect on how I started today. And I said, I'm teaching you today as though I were teaching seasoned PTAs. Not that I'm teaching entry level, and do you see what we've done is we have put tools in your toolbox. Like, I've given you things and probably you're thinking, wow, I could have done that with that patient. I could have done that with that patient. I could have done that with that patient. What's really effective is when we teach these things and we have pro bono clinic going and you walk right out of here into pro bono clinic and you're like, let me do this. We don't have that. I'm sorry, I really am. absolutely the greatest weakness of our curriculum right now is that we don't have that to lean on. Let me jump back into this though. Alternating isometrics, that's easy. You're using an agonist and an antagonist, and you're just doing that. Rhythmic stabilization, very commonly, is isometric with rotation, but it's also many times performed in such a way that my contacts don't change. All right, so you ready? Here, rotation. Is that agonist, antagonist? Yes, it is. Okay, but it's very predictable, and it's rotation. Rotation. It's rotation. Now, you'll hear people many times say that this is rhythmic stabilization. Now watch what I'm doing here. Resist me. You isometrically resist everything I do. Got it? Okay, relax for a second. Hold your arm up. There's shoulder flexion, extension, abduction, adduction, internal rotation, external rotation, abduction, extension, flexion, abduction, adduction. So random. And then as they advance, they start doing this. Hold your arm up. You ready? Mm-hmm. Is this shoulder healthy?
Yeah.
Okay, good. Because Bill just walked in the door. That was proverbial. Everybody's looking. What? He's going to judge us again.
Seems like a nice workout.
It is, but he's really bad at it.
Try to do it on me. Shoulders will pop.
Okay, so that's rhythmic stabilization. It's isometric. Many times it needs rotation, but it could just be the randomization of the isometric contractions. I am not going to get too deep into that one on the test because there's just so much differentiation. It's like the contract relax thing. I want to present it, but I'm not going to pick on you about that one. Slow reversal and slow reversal hold. The last two techniques, and then you're going to know them all. All right, so I'm going to default to D1 because you need to see it more often. Go ahead and drop that foot for me so everybody can see. Okay, D1, right? So I'm facilitating the movement. Facilitating the movement. All right, so I'm going to bring back now the inhibition. We're going to do concentric. And all we're doing is going concentric through the full range of motion for the agonist and the antagonist. But it's concentric. So we're here, and I say come back up to D1 flexion. Good. And I'm resisting concentrically, and then I pause. Now come back to D1 extension, and I'm just resisting. That's what they're calling slow reversal. So it's a lot like this, but it's not isometric. It's concentric. Now, the next one is just as simple. It just has hold. So what do you suppose they threw in here?
Isometrics.
Exactly. And it's at the end of the range. So come on up. I'm concentrically resisting. Stop right there. Now resist. Now back down. And hold. Right? It's just another fancy tool in your tool belt. all this stuff right here. Manual contacts, lumbrical grips, really teaching you how to be a therapist. Because the last thing I ever want to see go ahead and do me some ankle pumps. Good. Can you do 20? That you need to go ahead and do a little more. Okay. That therapist sucks. If you had that therapist as your CI, I'm sorry. They suck. And if that's you, then you need to change right now. Don't drive off the cliff. This stuff can wait. You do it later. Get your hands on that patient. That's the physical and physical therapy. Break off into groups again. Run through it. I'll give you more than 7 minutes this time.